Welcome everyone to 2022 Cap Times Idea Fest, and thank you very much to the Cap Times for putting this event on each year and offering us a great opportunity to reach out to our community here in Madison. As you guys may have seen from all of the posters around and the literature handed out, the global topic of this year's Cap Times Idea Fest is the state of change. So we certainly all know there has been great societal change since the onset of the pandemic, perhaps nowhere more than in healthcare. At today's panel, experts from Quartz and UW Health are going to tell us about how these organizations have innovated and adapted through this challenging time to create health solutions that meet people where they are, helping our members and patients create a life well lived. So I'm going to do a quick introduction to each of our panelists. I'll go in order from my side over. So the first is Elizabeth Priller, Director of Diversity, Equity, Inclusion, and Belonging at Quartz. Elizabeth, would you like to introduce yourself?
Thank you so much, Miranda, and thank you all for being here today. Again, my name is Elizabeth. I am a original Chicago native and as of 7 days ago, a Wisconsin resident. So thank you for the warm welcome. But yes, I am the Director of Diversity, Equity, Inclusion, and Belonging at Quartz. I've been a registered nurse for 23 years, spending my time in education, compliance, patient care, and with all of that, always having a lens of the experience of the person on the receiving end. So happy to be part of Quartz.
Wonderful. Thank you, Elizabeth. To Elizabeth's right is Allison Henke, VP of Regional Operations at UW Health Ambulatory Regional Services.
Thank you. Yes, happy to be here today. I am a nurse by background as well for the last 32 and a half years. I've spent most of my career in the region. Growing up in the region is how I like to refer to that. My team is responsible for all of the regional clinics throughout Wisconsin and Illinois and beyond. We're putting out adult specialty and pediatric specialty so that patients have access in their community.
Wonderful. Next panelist is Cassie Vanderwall, PhD, RD, and Manager of Clinical Services Diabetes at Quartz.
Good afternoon, everyone. Yes, I am Cassie, and I started my career in Chicago's medical district as a registered dietitian. Since coming to Madison 12 years ago now, I have experienced the classroom with medical students. I've experienced a managerial role over a team of registered dietitians, but most importantly, I've enjoyed my time equipping and empowering populations and achieving change in the area of chronic conditions.
Wonderful. And last but certainly not least, Dr. Roanne Osborne, Medical Management Vice President at Quartz.
Hi, good afternoon, everyone. So glad to be here. So I am a family medicine physician and addiction medicine physician. I still practice in addiction medicine. I've been a physician for over 20 years and spent a lot of my time in the federally qualified health center space. So Medicaid and underprivileged populations has been my forte, and I continue that at Quartz. Thank you so much for having us.
Wonderful. Thank you all for those introductions, and mostly thank you for being here. So as I kind of kicked us off, we all know that the pandemic had significant impacts on our society, especially in the healthcare space. Let's begin this conversation by sharing some of the highlights of how the pandemic changed your organization's approach to patient care. And let's begin with Allison.
Thank you. Great question. So we pivoted quickly, I think, as everyone did when it came to the beginnings of the pandemic. We were, I'll say, fortunate in the fact that we had time to make adjustment, unlike our counterparts, obviously, on the East Coast. So we learned quickly from them, and we set up resources and programs, again, to help meet patients where they were. Some of that included our EICU, which is an electronic ICU program that we have at UW Health. We monitor patients not only in our hospital, but in community hospitals across the state, as well as into Illinois. And so why is that program so important? Again, it's our critical care intensivists and our very experienced ICU nurses functioning behind the camera, helping the regional patients and those regional staff members to keep that care local. We helped them keep vented, proned, dripped patients that they would have normally not been able to keep. And again, why is that important? As you all know, beds were at a premium everywhere in the state. The statistics kept increasing. Bed capacity was definitely a challenge for all of us as we had many different surges. So that program was very instrumental in helping us keep the right patients in those local facilities. We also leveraged our telestroke technology. So that technology is a mobile cart in the emergency rooms. So again, if you were COVID diagnosed by a regional emergency department physician and they had questions, they could get on that camera with our intensivists, again in the ICU, and help provide recommendations of care for those patients. So we did a lot of things very quickly to, again, care for those inpatient side of the equation in the regional communities. And we also did it in our ambulatory clinics, which is, again, more of my responsibility, both pediatric and adult. We don't have large clinics in the region. We're in 84 different locations with our clinics throughout the states. So when we're looking at space and keeping physical distancing in mind, how do we serve patients and, again, respect all of these new requirements that are put upon us? So telemedicine visits were huge. We triaged patients, those that needed in-person visits. We commingled them so that they came in on certain days. Others that we could do via telemedicine, we commingled them so our providers could stay back in the Madison base, but we could have those visits with those patients. And then when you think about the state of Wisconsin and just geography, there's a lot of opportunity for failure points due to not enough cell service to support a video visit, or potentially not the actual internet connections in those rural communities for people to support these connections from their homes. So again, we quickly pivoted and we said, how can we help these patients continue to have access to care? We set up inside of our full-time centers the ability for patients to come in, use our technology to have that visit with that specialty provider back in Madison. And again, with a focus on the fact that it's not just the technology and it's not just the fact of the pandemic that we did this, but sometimes patients are just too sick, right? And as a nurse, you want to take care of patients and offer them the best experience regardless. So they just want that help. They may have the structure in their community or their home to support it, but they just don't want to deal with it because of their wellness journey and where they're at in their disease process. So lots of innovative ways to help patients have access to care, and we're continuing with those.
Wonderful. Thank you so much, Allison. Dr. Osborne, can you build on that to talk a little bit about how Quartz changed the organization's approach to member care during the pandemic?
Yes, great question. So one of the things that we did was expand our complex case management program. And the case management allows nurses to actually contact patients and help them to navigate healthcare. As a physician, I know I sometimes don't always spend a lot of time. I don't have a lot of time to explain, for example, where to find or how to get your prescription renewed and things like that. But at Quartz, we actually have nurses that we can connect with and care coordinators who the patient can connect with. And we've expanded that so that now we have a greater ability to help people navigate healthcare, call and set up appointments, make that call to the specialist, call the pharmacy if necessary. Connect people with community health resources that they may not be aware of. So we have expanded that program. And in the behavioral health space, we also have someone who reaches out to people who are discharged with a behavioral health illness or a mental health illness. So we're looking to expand that as well. One of the other things that Quartz has done is not only to expand the complex case management program with nurses and with outreach after discharge, but we're also reaching out to our behavioral health providers. So we know that behavioral health and mental health was a big focus as a result of COVID. And so we know that access can be an issue. So we are actually going physically and meeting with some of our mental health providers to, make that connection so that we will have places to send our patients to when they are discharged. So we are looking at expanding our provider selection and also meeting providers so that they know that when we call, to get a Quartz member in or a Quartz patient in, they will know who we are. The last thing that Quartz has also done is work on vendor partnerships. And that kind of gets into using digital tools because we know a lot of people were home for COVID. So there was not a lot of, there was even less access in person. And so we know that we had to expand our offerings to now be able to reach people in the home.
Wonderful. You guys both brought up the kind of advent and emergence of utilization of digital tools to help reach patients where they are. Cassie, can you talk a little bit more and expand on how Quartz has employed those digital tools? And subsequently, how has Quartz helped ensure that digital literacy and digital infrastructure do not become new barriers to positive health outcomes?
Thank you. So I'll start by saying that the pandemic was also an opportunity for Quartz to modernize our care model. We wanted it to be sure it was patient-centric, not provider-centric, not payer-centric, but patient or person-centric. And in doing so, we identified that there are really three tenets to that. There's physical well-being, there's mental resiliency, which is of pivotal importance now coming off of the pandemic, and social and community well-being. And from that, we started to look at what were some conditions that were really high in prevalence, so high in numbers, but also high in cost to that mental well-being, but high in cost to just dollars in members' pockets, dollars in healthcare pockets. And therefore, we came out of that with identifying that there are several chronic conditions that top the list, diabetes being one of them. We saw most nutrition-related chronic disease states really skyrocket with the pandemic as people experienced stress. They turned to coping strategies that maybe weren't the healthiest. So we saw obesity numbers and diabetes, hypertension increase. We also see chronic heart failure, congestive heart failure. While it's not very high in prevalence in our community, it is very costly for the individual and a very high risk for readmissions. So those were the big three that we decided to focus on digitizing, or really focusing on offering programs that come to the member. While people are safer at home and are starting to understand the fragility of life, nothing like losing millions to tell you how fragile life can be, many turn to themselves to say, okay, what can I do better? How can I embark and change? And the way Quartz has met them there is we have first an opportunity for members with type 2 diabetes to reverse that condition or put it into remission, not manage it, but say goodbye to it. And that is possible through a vendor partnership where individuals engage in a very restrictive carbohydrate diet under medical supervision and see their A1C drop to pre-diabetes levels. The other one is a remote monitoring opportunity. So it's more a self-engagement tool. So if someone has high blood pressure or chronic heart failure and they're already keeping tabs on their blood pressure or their weight or other symptoms like breathing or difficulty breathing, that they can text those in or call those in to a dashboard. But that dashboard is monitored by a nurse, a health coach, or a care navigator. So when those numbers tip into a red risk zone, they get a call. So they not only get the nudge to take care of themselves, they get a call back when those levels reach those thresholds. And to the question regarding digital literacy, so particularly that last intervention or opportunity that I shared, it has the opportunity for not only for those with a smartphone, but for those with telephonic entry. So a smartphone's not required. They just need a landline. And we are really trying to make sure that our treatments and opportunities are equitable by all levels of literacy and geographic. As we know, bandwidth is very different based on where you are in the state.
Thank you, Cassie. And Allison, you touched on this a little bit as to how with telestroke and the EICU, UW did push forward a number of digital innovations in response to the pandemic. Can you elaborate on those? And then also the same question of help us understand how UW prevented those from becoming new barriers to positive health outcomes.
Absolutely. So again, I think, taking into consideration the challenges in the different markets. So where we have different clinics and different access, really working with those leadership teams in those areas and saying, what do you need? What tools do we need to put on site? That was a huge piece of it. No one had the telemedicine visit platforms stood up. Everyone stood those up within days and weeks. And with us having so many different physical locations, we had to make sure that what we put out, it was the right product across all the different markets. So that's why having the ability for those folks to be able to come in and use our technology was huge. To your point, not everybody has a smartphone. So we were allowing telephone visits because we have to. When we were able to stand up the more robust video visits and also stand up my chart video visits for people that did have the technology, that was also a huge piece of this. So I think it was, again, access. And then when a patient said to us, I don't want to do that from my home, then bringing them in and helping them with the technology. That was really, I think, the key to our success, because patients did not want to travel into Madison. Our clinics grew and expanded during this whole public health emergency, which we're still under right now. I mean, we're still under that particular, federal heading. So again, continuing to evolve with it is huge.
Wonderful. Thank you, Allison. So I think we all know that during the pandemic, as well as kind of at all times, vulnerable populations are some of the most at risk of negative health outcomes. How can efforts that your organizations are undertaking help advance the shared goal of improving health equity and specifically target those vulnerable populations? And we'll start with Elizabeth on this question.
Thank you for asking that question. And many of you may be thinking, why is a diversity, equity, inclusion, and belonging person talking about healthcare? Well, it has a direct impact, the experiences that we all have and all of the differences that we bring to the table. If we were to treat the patient with all of the same treatments, expecting the same results, we know that there are many differences that would impact that. So part of the department that I oversee, what our work is focused on is in preparing our employees to understand the experiences of our members and of our community, and understanding how their own experiences impact the outcomes of those that we serve. One of the ways that we're doing that is through employee resource groups, and our employee resource groups are focused on different tenets of experiences of the human experience. Some are related to different demographic groups such as ethnicity and race. Some are related to military service, because we know all of these different groups have different experiences and have different needs. From that, then we look at how do we bring that group to support our community in terms of equity, in terms of health equity, and how do we make sure that the needs and the voices of our community is being heard. The other thing I'd like to bring up is a question that I often will ask groups. And that question is when's the last time that someone asked you what's most important to you? When you're faced with a healthcare concern, or you go to the physician's office, or you're seeking care, how many times have you been asked, what's most important to you in this situation? And so part of my job is then to help our employees ask that same question, whether they're dealing with direct members, or they're learning things about their community, or they're working with each other, is what's most important to you in this? A lot of times we are focused on the golden rule, which is treat others as you wish to be treated. But I'd like to elevate that to the platinum rule, which is treat others as they wish to be.
Wonderful. Dr. Osborne, can you expand on how Quartz is working to meet the needs of vulnerable populations and reduce health inequity from the medical management side?
That's so great question. So we actually are using some digital tools to be able to find out what our members and our patients need from a holistic point of view. We know that during the pandemic, normally there would be sort of some rotation on and off Medicaid, and that was kind of stopped. So there were a lot of people who were able to stay on Medicaid, and because and not have to come off of Medicaid, which actually was a good thing for a lot of people who may not have had insurance. So we actually expanded our Medicaid team. We have a very diverse group of individuals who are now, some of them actually do outreach, so they actually go out to people's homes. They can help us find members if they are not responding. We have our case managers that I talked about, so we've expanded the Medicaid team. We're also using digital tools which help us to understand how patients want to be contacted. Some people want to text, some people want a phone call, some people may want to be left alone, but we try to work around that. So that is one way that we are using the being able to reach out to members and meet them where they are. I think that has been really important in sort of leveling the playing field for our members and making sure that everybody's treated, with the way they are supposed to be treated, the way they want to be treated, and also making sure that healthcare is equitable for all our members.
Thank you, Dr. Osborne. And Allison, can you speak a little bit about how UW Health has focused on meeting the needs of vulnerable populations?
Yeah, absolutely. So again, I think when you think about all of us are consumers of healthcare at some point in our lives. And what do you expect out of that encounter? And I think that's the lens that we've approached everything with. So even throughout all of the different surges, a lot of these inpatients had very long lengths of stay. We couldn't allow a lot of visitors, in some cases, no visitors, in some cases, one visitor. So how do you help the patient, right? Because you're feeling disconnected. You're in a hospital, you're in a pandemic, you're not allowed to have family come in. So what do? We leverage our tools. We use the technology and we allow them to have these electronic video visits with their family members. And again, you have to make sure that you have those tools available to them in the hospital. We did the same thing with our skilled nursing facilities. We did not want those patients to have to be transitioned in. So we set up video visits so that they could have visits in that manner and not have to leave the nursing home, increase risk of exposure, so on and so forth. And then when you look at the MyChart video platforms, we've expanded all of those and standardized them. I think that's the other piece, right? Because again, as every health system was standing up their tools and their systems, we had to come together and figure out what are the best platforms so that we can connect. Because again, we've got patients all over the state and beyond, and we want them to have access to care. And then when you're talking about some of the diverse populations, we have clinics, for example, that are focused just on the Amish population. All right, so let's break that down. We don't have cell phones, we don't have internet, we don't have any of these capabilities. We communicate through the US mail with these patients about their appointments, all of this. And so when they're coming into a clinic now, and we're in the middle of a pandemic, how do we work with them? What tools do we give them so that they feel comfortable and we're meeting them where they are and meeting their expectations? So there's a lot of pivotal ways that we intersect with our patients to make sure that it's a positive experience for them.
Thank you. So as we talk about these vulnerable populations, we know that social determinants of health can significantly impact patients' health outcomes. Dr. Osborne, can you share a bit about what these social determinants are and how your organization is working with communities to help address them?
And I'm going to pass it off to Cassie. I'm going to pass it off to Cassie.
Thank you, Dr. Osborne. So we know that the pandemic also revealed a number of social inequities, particularly those that are termed social determinants of health. So economic or financial disparities, unequal access to healthcare, and quality education, changes in the built environment. So what they have access to, whether it be broadband or a safe place to play or a safe place to walk or a grocery store that provides fresh foods. And then that social and community well-being, feeling safe in your community, having a sense of belonging in that community. So we saw many social issues rise, and we believe from the literature that accounts for 80% of the outcomes that we see. So this, of course, is impacting us as we think, again, about our care model, the way that we bring care to our patients, members, and people. So one outcome of that is that we have pivoted in our home delivery and tailored meal vendor at Quartz. So if individuals, upon discharge from the hospital, we know that can be a very fragile and vulnerable time, and individuals that are in our Medicare population will receive a call from this vendor offering 2 free meals a day for 10 days to help them, again, bridge the gap, get back on their feet. And these aren't just boxed meals. They are medically tailored, so that dietitian on the other end will ingest their discharge diet, which we know can be very complex when someone has a number of chronic conditions, meet with the patient telephonically to make sure that that's the right diet, and then tailor meals to that. We are also offering this for our members, again, with CHF for congestive heart failure, where they will meet again with that registered dietitian, receive coaching and counseling, and then receive medically tailored meals for up to 6 weeks. And if we identify in that time that they have nutrition insecurity, or if they have an environment that is not conducive to following or adhering to their prescribed diet, that can continue for another 6 months. And in each package of food, they will receive some curriculum too on how to tailor their food choices to their chronic condition and to their lifestyle, their culture, their food preferences, all of the above. And then I'll also add that Quartz is a new partner with the National Fitness Campaign, where we are looking to partner with communities that don't have a built environment that supports fitness and physical health. So you may hear more about these coming soon, where they're these lovely outdoor complexes that really foster community, well-being, and physical fitness across the country.
Wonderful. Thanks so much, Cassie. And Allison, can you share a little bit about how UW is helping to address social determinants of health and their impact on health outcomes?
Yeah, so again, I think it's understanding what's happening in the various markets and making sure that patients have access to our specialists, because again, we saw a lot of avoidance during the heights of the different surges. And so again, we wanted to make sure that we could meet people where they were. We've had Care Anywhere visits for a very long time. That's been part of our platform for several years. We're exploring some of the different, medical at home programs, the different points Cassie's brought out with, being able to make sure that we can care for the CHF patients at home. So think about if any of you did have an encounter with one of our providers during the pandemic, or any provider during the pandemic, you have to emulate the in-person visit over the video visit or the telephone visit, right? So one of the things we quickly learned was that when we brought the patient into the video visit room, at first we didn't have our medical assistants and things involved. Well, think about what happens to you when you actually enter the physical room. Someone brings you into the room, they take your height, your weight, go over your allergies, review your medications with you. Why are you here today? Are there any other things that we need to address, right? Early on, none of us had, I would say, put all those workflows in place. We quickly realized that was a huge miss and we needed to redirect. So then we went to remote rooming. What are the remote rooming protocols? How do we gather this information? How do we then seamlessly hand that patient off to the provider so that they can go to the next step of the visit? So these are all the things that we did either over the phone or electronically on a video visit, whatever technology we were using. If they were coming into our clinics, then we did room them in a room, and then we had them get on a video visit with one of our providers. So a lot of adjustments in the care model, but again, wanting to make sure that we're gathering all those very important pieces that make that a success. Because that's where I think you get a lot of your information. As a nurse, I know that's where I get a lot of my information when I'm having that encounter with that patient, and what do they need, and what can I physically look at, and what do I pick up on? And then what is your weight today? If you're a CHF patient, that's very important. How have your blood sugars been going? What are your barriers? We're addressing a lot of that too, and then helping them get those additional resources that they need for success.
That's great. So during this conversation, we've discussed several significant advancements in how our healthcare system works. Many of these changes involve system-wide change to the organizations we operate in. Elizabeth, can you talk a little bit about how Quartz is preparing staff to support those changes?
Yes, and by a show of hands, how many love change? Some people do. That's another thing. We keep bringing up the pandemic, but change is inevitable. But what happens is the brain doesn't necessarily initially love change. And so when we have employees that are kind of all over the board with accepting or embracing change, one of the things we've started to focus on is helping employees understand the neuroscience of change and what's going on in the brain when you're faced with something new. And why sometimes change feels good is because maybe it's in alignment with your values. And so we've really taken an approach to start to help our employees understand their core values. What's most important to them? We go back to that question. When we understand what's most important to us, when change then happens, we can tie those together. So we've helped our employees to understand what's most important to them, what their core values are. And why is that important? Because again, we are focused on our members and our community. So there's not one human alive that doesn't have one or two things that is most important to them that they will always focus on and deem as important. Another point that I would like to make too is that with that, we then take another approach and looking at change management and how do we become innovative? How do we constantly stay ahead of the curve instead of being reactive to all of the changes? And another method that we use is something called appreciative inquiry. And that's asking a question that is focused on a positive core. And that's different than problem solving. That's different than looking at a problem, finding the problem, and fixing the problem. We also like to take an approach of what is working well, and let's replicate that. So again, preparing the employees to navigate change and then also identify what's most important to them.
Wonderful. And Allison, can you shed some light on how UW has specifically worked to prepare staff for all of the changes that you guys are implementing?
Yeah, so I touched on it a little bit when I was speaking to some of the workflows that we had to quickly, stand up and pivot to. And I think that, we're always looking at our employees, our workflows, our standard work, and identifying opportunities. I think one of the biggest things right now is, again, back to what is the patient preference and making sure that our employees are geared to, again, meet those patients where they are. So right now, we do still offer video visits. There are some patients that is all they want. They do not want to have to come in for an in-person visit. So for example, in our pediatric areas, the pediatric volumes have stayed very high for video visits. And when you think about young families and people that have young families, you would have to not only bring in the child for their visit, but oftentimes there's maybe one or two other siblings that have to come along or whatever. So again, that has been a big impact for our pediatric departments. And then again, if we're doing all a majority of video visits for those wellness checks with them, then how do we adjust with the staff model to make sure that we're getting all the information? Because you've got the little one that you have visibility to, but yet you've got to have a parent there as well, or that guardian, to make sure you're getting all that information. So again, I think it's that, what tools do the staff need to make sure that video visit's a very positive one. So those are all things that we adjust based on. And then when we're at the other end of the spectrum, when we have more elderly patients, sometimes they want just a straight telephone visit, landline visit. They don't want any type of phone. They don't have that technology. Again, they don't want it. They may not be at a state in their journey where they can actually come in for that visit. So we do honor those telephone visits because, again, we think that's important. And again, making sure that we're asking those key questions during that remote rooming is a huge part of that. So scripting, asking questions, in the right manner to make sure you're getting a positive response from that patient is huge.
Wonderful. We've got a couple more questions here for the panelists, but I did want to give a reminder to everybody that we are happy to take some questions from the audience. I've got one here and a note from Chris that if you do have a question that you would like to ask, just throw your hand up. He will come and grab the card from you and bring it up to me with any questions that you may have for our panelists here. So we've talked a lot about change, and as we know, the theme of this event is state of change, and it's a theme that our society really is deeply mired in right now. Elizabeth, you talked a little bit about how change is hard, basically, right? Who raised your hand? Who likes change? Can you elaborate a little bit about how Quartz is kind of pushing through to embrace that change and what that change philosophy is, despite that being something that is really hard?
Yeah, so to go back to the brain that all of you in this room and those of you watching remotely probably have. I'm not going to assume, but we all have a brain. Our brains are funny because we think that they're there to serve us, but we have to also inform them what is most important to us. So the way that we're really focusing on innovation is how I shared earlier is looking at staying ahead of the curve. The pandemic, we were reactive. We didn't have a lot of time to make change. And so we had to just kind of go as we were, learn as we were going. What we'd like to do now is look at what are the needs of the communities and how can we best serve them. And the way to do that is to get to know our community, get to know who are we serving, what are the unique needs of those individuals. One of the other things that we're doing is seeking accreditation with an organization, a governing body, to elevate our level of service. And that's referred to as NCQA Health Equity Accreditation. And what that does is it gives us a model and a focus to elevate some of our services so that we can make sure that patients are receiving culturally and linguistically appropriate services and again, making sure that our employees are prepared to serve the needs of of the communities that we serve.
That's great. Thank you. And Cassie, can you build on that a little bit as well from the clinical side? How is Quartz embracing that call to iterative change, and what is that change philosophy?
Yes, our change philosophy is adaptive change and iterative change. So one change leads to the next, and we have to be comfortable with those quick pivots. I think we've been reconditioned, if you will, to be a little bit more accepting of change, as we know that there have been a lot of good things that have come out of the pandemic. There are some silver linings if we hunt for them. And I believe that we can embrace that at Quartz at the system level, but we can also celebrate it within our members and our patients and our people, in that we have overcome a pandemic together, and there is this sense of resiliency, and we can celebrate change. And we try to do that in our programs. One way that we are building that in is through incentives and rewards. So when individuals participate in our chronic condition or our physical well-being, or even just getting their routine screenings and preventive measures, we're able to reward them in a financial manner, but also in just a general high five if they connect with their care manager, or as they reconnect with their providers, they have a report to share, a report card that they're proud of that they could hang on their refrigerator, right? And so I think that's another way that we can not only embrace change, but celebrate change that's in a really positive light. And the other way is to be data-driven, but not so data-driven that we forget the voices of our customer that Elizabeth keeps highlighting, right? We can follow that platinum rule and still look at the data-driven quantitative outcomes. And that helps us really make not only an informed decision, but the right decision in building programs that will serve our community well.
Wonderful. Thank you. And we've got one more question here for all of you guys that will kind of round out our talk here before we move on to at least one question from the audience. We've talked a lot about meeting people where they are in a literal sense. We've talked about doing so with digital tools like apps or video visits. We've talked about outreach directly into the community. Can you guys each tell me a little bit about how your organizations are working to meet people where they are on their wellness journey? So, for example, through prevention or through a focus on specific conditions. And we can begin that with Cassie as well.
Thank you. So I believe one way within clinical services at Quartz that we are truly meeting individuals where we're at is we're using health risk assessment data to really identify where individuals are at in that journey, but not stopping there, really looking at what their rising risks are, and then most importantly, finding out what's important to them. And we can leverage that through big data, or we can simply ask the person. And I believe that when you apply that with some of the behavioral theory, such as social cognitive theory that we know that there are just some basic tenets of wanting to pursue change and identifying change and what people need to be successful in a life well lived. And that really is knowledge of their condition, a tool to monitor it or improve it, and then a relationship. Either it's improving the relationship with themselves, a relationship with their provider, or their community. And I believe that as we address those things, we really can support iterative change and meet people where they're at.
Wonderful. Dr. Osborne, would you like to add to that from the Quartz perspective? How are we working to meet people on their wellness journey?
So I'd like to actually tell a little story. So one of our Quartz members, and practicing in addiction medicine, it's can be a little challenging. So one of our members, he had been to the ER a lot of times in the past couple of months, and for you to make a change, or for someone to make a change with who has addiction, they have to be ready to do it. You can't make them do it. You can't force them to do it. They have to come to the space in their lives where they're like, okay, I'm going to make this change. And so our behavioral health case care navigator, he had talked to this guy over and over every time he was discharged. This time, actually, he wanted to make a change. He said, I am going to make that outpatient appointment. I'm going to follow up. I'm going to get treatment. I'm going to get my life right. So our behavioral health care navigator, he said, great, I'll set you up with an appointment. I'm going to call and make the appointment for you. So he worked with the patient to do that. And normally that's kind of where, our contact sort of stops. But he actually went back and checked and realized that the patient did have an appointment that was maybe 4 or 5 weeks out. And when somebody's ready to make a change, you need to kind of get on the ball right away. And so he actually made some phone calls and got the person in a lot sooner, so that we were able to actually capture when he wanted to make the change, which was right now. And so that is where, one example of Quartz meeting people where they are. We're not just going to stop and say, well, you have an appointment for 6 weeks out. Yeah, okay. Well, we hope you keep the appointment. We'll probably call you in like 5 weeks to make sure you keep it. We're actually going to try to work with you, especially in challenging cases like this, to make sure that you get the help that you need.
Wonderful. That is a great story and a great example of meeting people where they are on that journey. Allison, would you also like to share how UW Health is specifically working to meet patients where they are in their wellness journey?
Yeah, sure, absolutely. So again, I think, from the lens of the regional model, that's exactly what we're focused on. We're out in these regional markets and communities and working with those leadership teams to understand, what do they need? Every market is different. Some may need more adult services, some may need more pediatric. And again, I'm in subspecialty care, so what do we need to do to help keep those patients local? They may have to come to Madison for certain testing, for a procedure. There are certain chemotherapies, for example, that can only be given in Madison. We can't administer them in the region. So again, we're reevaluating all those things all of the time, having those patients have the care they need in Madison and then returning them to their communities. Our specialists work hand in hand with those primary care providers to make sure they have the tools they need so those patients can stay local. And then our subspecialists go back into the region and do those follow-up cares there. So again, patients don't have to travel. And then when you're looking on the inpatient side of the equation, obvious just growth in new buildings and infrastructure, and what we're doing with, leveraging technology, research, so on and so forth. That's always evolving and changing every day. It's very specialty specific. So a lot of fun and new exciting things on the horizon as we build the new East Side campus, which is really focused on that oncology side of the equation.
Wonderful. Thank you. And Elizabeth, would you like to add to how Quartz is working to meet patients on their wellness journey?
Yeah, I would say we take an indirect approach, working with our employees, again, making sure that they're engaged. And what does that sense of belonging mean? We all want to feel part of something, whatever that looks like. And so making sure that we're being intentional about our hiring practices, making sure that we're hiring people that share a core value that is similar to what we established, that is important to the organization and also important to our communities. And making sure that we're focused on that sense of belonging also for our members. And so that is the transition point that we are looking to make, is making sure that our employees are engaged, making sure they have a sense of belonging connected to their values, and then taking that out into the communities.
Wonderful. We've got one question from the audience so far. Again, if you do have questions, it looks like we have at least one up here in the front, Chris. So I'll begin with this one, and I think this may be a good bet for Cassie, but I'll let you guys just jump in as to who thinks you'd like to address this audience question. So how proactive is the healthcare industry in educating the public to counter the advertisements that influence the public towards scientifically proven unhealthy food and drink choices?
That is a good question. And as a registered dietitian, I will happily take that question. So I think everyone has their own voice and choice, right? Everyone can be their best advocate. I believe where the healthcare community, including the payer space, comes in is, again, leading back into those three facets for success and full outcomes, which includes knowledge. So what is a healthy choice? What is a once in a while choice? What does good health look like? And what will promote a life well lived? And then what are the tools that you'll need? It's not always money in our pocketbook or more time. Those seem to be the two resources that we always blame when we can't make a healthy choice. But it is also making sure that we have tools to monitor our chronic condition. And then again, the relationship. And that's where I think the payer can come in, is helping to connect A to B, member, patient, to their provider, so that they can make those educated decisions. But in terms of facing off against the advertising industry. I don't think I have any magic wands or tools except for to make the choice that will support your lifestyle and however you describe health.
Great.
So, another way in which we are a little bit proactive, thank you for that question and that answer, Cassie, is case managers. So, we have our case managers who are at Quartz and they are registered nurses. And they help our members and our patients with everything. So from, what is, questions about their medications, when the discharge of their medication is different from home, at home versus, what they were discharged with, calling to set them, get an appointment with them to ARDC or some other community-based organization. So, but specific around unhealthy eating, we do have health coaches and we do have our case managers, and they are able to actually advise our members and our patients, especially those who have chronic conditions where unhealthy food will likely exacerbate the condition rather than fix it. They are there to work with the patient around starting where they are, looking at the maybe cultural foods that we can adjust. I mean, that's something that they can do as well. So our case managers are definitely key to making sure for those who are in case management, making sure that the unhealthy choices are sometimes, they have a little input about the better choice for them. And for case management, they can be referred by a family member. The patient can refer themselves if they would like case management. They can also be referred by their provider, so their physician or midwife.
Thank you both. So we have another audience question here. You have each mentioned ways your organizations have acted to serve rural communities. Could you please expand upon both the metrics you've utilized to know you're meeting the needs of rural patients, as well as how you've leveraged your role as community anchor institutions to strengthen the economic vitality of rural communities in partnership with local rural providers? And maybe this is something Allison can dive into first, as I know you've talked a lot about specifically the Amish community or other ways you've addressed kind of regional needs.
Yeah, absolutely. So again, I think it's key when we're out building the relationships with the regional leaders in the different hospital settings. We listen to them. What are they seeing happening in their communities? Are they seeing out-migration of a particular specialty in their areas? So, for example, are they losing all their oncology work? Are they losing all of their orthopedic work? Maybe they only have providers that are there certain days of the week, and then the other days of the week they don't have coverage, so they do have to transfer those patients. So we really rely on them to tell us what they need, and we look at their data. And then we say, all right, it would make perfect sense for us to be a cardiology solution for you. And then how much cardiology do you need, right? They can always call us at the Access Center and get one of our specialists on the phone and go over a specific patient. But if they're really looking for an in-person clinic, what do they need? And so we try to right size that in conjunction with them. And I will tell you that our two leaders normally are cardiology, both adult and pediatric. And when you think about it from a health systems perspective, once you clear a cardiology consult, that usually allows that patient to move forward in the health system, right? You've got to have the healthy heart. From the healthy heart, then you go through whatever other testings and things that you need. So we also have a lot of remote read agreements. So again, if you have a stress test in a smaller community, or you have an echocardiogram in a smaller community, they might not have a cardiologist there to interpret it. They have a supervising physician that can allow that test to occur locally, but then they push the study to us, and then our cardiology teams are in the background providing those interpretive results and pushing them back. So, again, you're leveraging technology with all of that. Those are a lot of things that happen in the backgrounds between our multitude of different rural facilities and the UW that probably most people don't know about or understand. They just know, oh, this person's going to read my study and my provider's going to get it back to me. So we look at a lot of different things to make sure that they have that access in their communities.
And is there someone from Quartz who can speak a bit to how Quartz utilizes metrics to know that we're meeting the needs of rural patients, and also how we're utilizing our role to strengthen the economic situation of the communities that we serve in rural areas?
So we do use data, and the data will let us know, sort of where our patients are located. So we do use data in looking at our chronic diseases, and also the location of our members. One thing that Quartz is actually in the process of setting up is meeting with our rural providers. We know that there are several providers in areas that may not be close to a major center or a clinic, and we are actually going to be meeting with primary care providers in sort of I don't want to call it a roadshow, but we are going to meet them and, talk about the difficulties that they have, talk about their patients, talk about, what they think they need in a location that is actually central to the clinic. So that is something that we're actually starting in the fall. And so it would help us get a better idea of the needs of not only patients who are located in that area, but also our providers.
Wonderful, thank you. And we got a question in, what is Quartz and what role does it play in the healthcare administration? So I could certainly take a stab at this as Director of External Affairs at Quartz, but I would certainly offer this question to the folks on our clinical and medical teams if you guys would like to give an overview of Quartz and kind of how we interact with the healthcare delivery system.
You want me to go first, or you?
Either one of you guys.
Okay, so Quartz is, and I'm going to put the caveat out there that I've been at Quartz for less than a year, but it's a health insurance plan that was created from it's sort of a different owner systems had different health insurance plans, and they came together to create Quartz. And so Quartz is a local insurance plan that provides healthcare coverage for our local patients. And so we utilize networks in the Dane County area, the La Crosse area, and in parts of Illinois, Minnesota, Iowa. And so we cover our members. We have over 300,000 members, and we cover them. And we have different, what we call lines of business in insurance lingo, but that means that we also provide services to those who have Medicaid, Medicare, Medicare Advantage, commercial plans. We have some large employer groups that we cover. So I hope that answers some of the questions, but we are local. And that helps us, I think, puts us at a little bit of an advantage because we can actually go out and meet members. We can actually go to members' homes if we need to. We can go to providers if we need to and meet with them, and sort of put a face to the name. We are not sort of the faceless insurance company that people are accustomed to. I'm just making my little pitch there, but anyway.
Absolutely.
And I can add to it if I may. So as Dr. Osborne said, that we provide that coverage, right? The insurance that people know it, but you've also heard about the way that we provide care. And we are doing so in a very thoughtful manner where we don't replace the care or replace the very important relationship that a patient has with a provider, but we do it by assessing our networks, assessing the communities and the regions to identify what are the gaps. If somebody wants this, can they get it within their local vicinity as that care being brought to them? And if not, then we think about a system-wide opportunity where we can offer that treatment to our members, oftentimes free of charge, like many of the programs that I've offered. So it's only really then that we step into that provider role when we sense that there's a gap or a disruption or even a hurdle that we can help overcome with our provider base. Otherwise, we are 100% trying our best to reinforce that patient-provider relationship.
Absolutely. Thank you guys both for that overview. And I would be remiss to not mention that Quartz is fortunate to be provider owned by a number of healthcare providers right here in Wisconsin, including the wonderful doctors at UW Health, which is why we are lucky to have them here with us today. So for the members of Quartz and the patients of our provider networks, that means a great collaboration and a strong relationship between your provider and your insurance company, which really helps in the care model and how the patient can kind of seamlessly interact with our system. So we just have about 2 minutes until the end of our time here. So I would certainly encourage, if you still have any questions, come grab myself or one of our panelists here, and we are happy to chat with you. I have also been asked to mention to you guys and provide a reminder that there is a vaccination clinic going on the floor here. If you haven't gotten your Omicron booster shot, that is available. There is also a reception happening following this panel, and another wonderful Cap Times Idea Fest panel taking place a little bit later this evening in the same location. So, Chris, is there anything else I should mention from the Cap Times side? Otherwise, we just really greatly appreciate you guys being here. Thank you guys again at the Cap Times for hosting us, and to Madison College for hosting us at this beautiful space. And thank you to all of our panelists for being here, giving your time this evening. We really appreciate your time, your expertise, and helping us reach out to the community.